that there is a split between the progressives in Congress and the Blue Dogs, and they said the Blue Dogs were putting forth a program or an idea supporting the idea of the trigger. How are you feeling about this?
Well,
Can you sort of explain what that even means? Because I'm not sure.
The first is the public option, which President Obama has called for, which I support. Now, President Obama hasn't defined a public option yet. We can have a big debate about that. But some people have said, fine, let's have a public option, but only pull it in if necessary, if there's not enough competition offered by private health insurance plans, and not today's private health insurance plans, but the new and completely reformed ones that in legislation will envision. But you know how the press works, they like to highlight differences. The sad part about most of this, I know most of my colleagues, how many of them have read this stuff? Like 4, maybe 5. We're really not that far apart. And I've already seen my colleagues all come together and hold hands in the White House. And that's what they'll do, because thank goodness we have a strong president. Thank goodness he is leading, and that's the way our government works. You'll never have a giant committee in Congress leading, because there's just too many disparate voices. But we have a real leader in the White House, and he is about to exert his influence. He's done it magnificently so far, because he's not writing the plan for us, but he's giving us the principles, then the letter, then there'll be firmer guidance. We should be proud, too, that the person in the White House who's leading the healthcare effort is Tennessean, Nancy Ann Parle. She's from Kingston, Tennessee. She used to be our commissioner here in Tennessee in Denver Furter's administration. She's a first-rate individual. So she's somebody that Tennesseans can relate to and trust and say, hey, it's just Nancy Ann. This isn't any sort of weird plan from Mars or something. It's our own Nancy Ann helping put this together. So that's a reassuring message, because remember, the key part of the debate is so many people are afraid of change. We have to make change, as Bill Clinton used to say, your friend. And I think we can do that. The details of this, I don't want to give you a semester-long course. I do that at Vanderbilt. I can wear anybody out on this. But it's we can accomplish a public option in a way that people like. But today most people have no idea really what a public option is. So let's start defining that, because we have a little time, in a way so that every American can feel comfortable with it. And hey, this is a good plan.
So what would you like for us to say now, this afternoon, about the public option?
We should be for one, just like President Obama's letter says.
So, I'm going to take maybe one more question.
Mark?
First of all, I want to thank you for coming and congratulate you for being so open on the health care, being accessible to the constituents through this whole debate. But really what I wanted to find out is, will you support public option without a trigger?
Well, my preferred position is support Senator Chuck Schumer's plan for the public option that has no trigger in it. I think he has done the best job so far, being a senior senator and in leadership, and much closer to the White House than I am, to say, all right, this is how you slice the difference. So I think that would be an appropriate solution, but neither Chuck nor I are the decision makers. President Obama is the decision maker, and I will support what he puts forward, because corporals don't run the Army. We have one general, and he runs the Army. His name is President Barack Obama, and I'm so thankful